catch before you call issue in national you run the catch me you as a health practitioner and as a health expert, you know, let's stay in the health particular because the whole program is about health. Catch it. Diana, a money so important. Say, yentimi for be health data and fun to ya.
Many am dasi, me diet tearful in answasi. About healthcare system na kasano. Though or seek to improve upon your general well-being, the health of the population. No, on so healthcare system within the healthcare system, whose health itself is sensitive. And about data, cancer will be more like na pomudin honsem. Na send na pomudin jinabia etie, and I send health state send a bruni bekano. Say, what they too dry? Now, what they too dry because our condition no has a wider implication on the total population. Then yes, our part there about healthcare ethics. When you look at the basic principles, autonomy, justice, normal efficiency, and even you taking the equivalent of informed consent from somebody. No? Na obi biade no ba apomuden bia na se hospital a nipa na ba se opese ne ho to no na sa nipa na so pese ne kokoa mu nsam no e se ono an ntumum enti se wunya sa information we bie now the comma uyonko anasa another country anasa even obi or hospital kwa and you're not here. Nature say nipa no kukuo mu nsam no na wuyi ato abonten no. Enti confidentiality in healthcare system no very key. E ho na me start here free. Na eba US Ghana agreement so a bilateral agreement between government to government agreement. Send from embassy no mama yati say US Department and declare the negotiations. Which means there is a certain aspect of confidentiality and secrecy in the system. And the identity as a Ghana so a ton Ghana for also no omo apomuden edema another mind. And I think say yes start a hopper and America.
All right. Okay. So the American First Global Health Strategy, America for a launch in September last year. What is it about? SSC could be a the condition is SSC reveal your health data and other data near normal. And on a
okay, so good. Medical started from 2024 before America First Agreement.
Okay.
Then you in USAID, United States Agency for International Development.
Yeah.
From our heart check. And now almost Ghana saying Bible about sending Ghana your funding your healthcare and even the healthcare delivery system itself. In January 2024, you're signing a bilateral agreement with the US government, and the total amount involved was around I think $25 million. It was supposed to help the Ghana health system, right from especially in primary health care, from the CHIP compounds to our local clinics to tackle preventive health care. In the agreement, U.S. government was going to fund about I think $80 million. Now Ghana buying so I funded the rest about 6 or 7 million now continue counter funding and another year providing. Now, I think somewhere last 2 years, when the current U.S. president will take it over, or stop it, all USAID operations. And the Mecca said after that, this has been his major initiative towards providing healthcare support. But we have this financing model now. Now to say local policy because a hango hanka. There is a trade-off. Sikano Emma $109 million ne makwa. Ebeba with Ghana also sacrificing or paying a certain component. And what they want is say Ombenya health data, unrestricted access. And I'm putting unrestricted because some say they want access to it without or with limited safeguards. Which means whatever data that we generate or whatever information that we get within the healthcare sector, so among sabeka. And I'm say from the newspaper and the government reject here, they are about to renegotiate. That is what I feel.
You are not the one that you are not the one that I should ask you this question, but your health, I'll ask you something about the health. But you as a Ghanaian, tell us Oman Penny John Dramani Mahama said that condition is aware of it that because okay that US for policy can the first American first global health strategy now okay say sharing of data is part of the agreement. So some countries had already gone there. They wanted to have the same agreement, but based on that they rejected it. And Oman Penny is privy to all these things. So how come that Oman Penny didn't who call Roman Sana or Sakasa Onye? Abra no nimse Sadia no Honada.
My father say I had to say contract in the agreement here. Terms, some of the terms can be varied. And to me, sure say team no minimum team call here. But the team went with the notion say maybe on bet me vary some of the terms. And may assure someone Payne will take every decision via a benefit to Ghanaians. But here is the case, I have clause maybe there is a certain position and benefit to Ghanaians. And you know, I reject. So I am sure they went in with the notions and at times maybe can be varied. And he says, yeah, or rejected completely, no minimum avenue a war. Omubetimi accord through to change the terms. But if we are resubmitting our agreement there, then definitely we may have to make some concessions, any trade-off. But minimum, what will compensate for the data now, young farmer? Because US and also will look at the benefit of getting from this agreement. But I'm sure the country, any team, will have to consider the wider implication of this very term in the agreement where they can have access to our data without or with limited or safeguards.
Okay. Now, don't catch any. Say ya farmer omo yanko. But ye kase data, health data, it is very, very important. Uko Kenya, the same issue be something like that. I happy with Kenya. Emma. A consumer protection group be at the court to abide how to hold on say sikano oba be yusuno. Doesn't mean say me call hospital be nese bia me information and I be data say no for the data beboa.
That's right.
Okay, so say bia health worker be and also be could reveal me data ma second person show me data. Met be the said the pana court and I met me see hospital. No?
Yeah, so I think health system has been run based on WHO's protocols. From our matter declaration now to even the oath our doctors take. Okay. Try to maintain the highest ethical standards when it comes to data. And when you look at your system now, sometimes they made me say Ghana hire co hospital because it's near Pomudin.
Yeah.
Co hospital because you're Pomudin.
Yeah.
Say we near Pomudin and into co hospital there. Then the over here so do how you can do say nurse heme, doctor heme, namen kwana. But Oko hospital say Pomudin there. Now it's just a pomudin and who to best start right from prevention to follow baby questions. And the answer before the actually mini be bound to me mechanic. nurse ni bi ameneniti me area me condition won't me nkoka. Hospitals, Nemra Hospital Act, it protects every individual from going from suffering this kind of situation. However, when it comes to your actual practice, let me say how secured is the LIMS system now? You wanna even capture data across all hospitals.
Yeah.
And I think this is something that we really need to look at. We need to look at data protection, we need to look at safeguarding, and we even need to look at patient rights within the healthcare system.
So that is what I was asking, say BBC bar, for example, me Mako Hospital, yeah, Ghana for, you see, you release your health data and from America for, say, yeah, the bar for one. Send your Kenya for etimidi omodi ya no court no see the ba for moi me Mako Hospital me person nipa begunu de ha me nurse ni bi ne me nete wote be me na wakati obi a me be no say yare we say ne ha me say me hunu say efi honom na say hospital ho no oma release e bia me bi data de ha me ne de akere second person na me person nipa no begunu a metimi asiu that hospital no.
Yes sir, if the data no be published. Now what evidence say it has been released contrary to the law now. Who bet me assume? But me issue ne say here kura na be say ya release. Wahu.
Yeah.
Say ekoba say obi kokan ye anase ko hu wo ba bia. Wa bet me take initiative no to seek the necessary legal redress. Okay. Where you can sue even the individual and based on vicarious liability, so the sue facility and the Ghana health system itself. But maybe before we even get to that point, we had the necessary safeguards essentially putting in place as hospital management, as Ministry of Education, even as opinion leaders and gatekeepers within the healthcare system. Then you better secure your data. Now, my questions were made to me as a twama yem timamufu ne abain and say, I don't know be more sikaka kraka with data per any hiano, and our data per the hiano. Then no the data ne. Now, dear no the data ne, and one can answer what so this, or you should data in that way at the solving problems. I think that is one key question we need to ask ourselves as a country.
Okay, but Doc, America for some health data, some of them are outside because I remember in 2015, America for a research, our research say by 2035, if care is not taken out, we 10 Americans age now. Ebube 6 ebe diabetic because of candy foods aomudi your father say glucose ne and numbness and so they have to come out with a policy I bet me streamline and as I kept that situation. So a country is telling you that in the shortest time or 10 to 20 years time, if care is not taken, what the 10 American Jawa say is it not the data I'm releasing the about? So at the end is so serious say to be fair the moment says can.
Yes, so I think sir for a country's health data they release. Yeah, what is a government account number of malaria cases for this year incidents fine. And no dear globally, WHO our big database out near access country specific data. However, say who data no ye say cover nipa no ho, let me just use that word. Na ya pointed to specific individual bi akwasi mensan ya malaria adwo anya we no problem no one. I will narrow it down to the identities of the individuals and the kind of data they want to access. Menya sure say data yang kasa through statistical service and Ghana health service through your demographic and health service you produce omo per clinical data right from the hospital, I better link it to the individuals. I'm sure when the data, there is no safeguard in the access, then definitely the principles of the ethical principles may not be ensured.
Okay.
And at that point, it means obiara fi amanfo afi sɛm ɛna ɛba abɛda abɔnten.
Abɛda abɔnten. So Doc,
yeah.
sorry to cut you. Sorry. Doc, catch me. I should have asked you this question and Sakwana ya proceed. Say health data na nkasa ye die ya kika ye no health data no. Enkoma ye di. Eno na America for pay. They said ye aya na me no kasa bi a Ghana Health Ghana AIDS Commission for the release beba 300,000 people are contracted AIDS for this country. Malaria Ghana for nipa dodo say the ku omo nipa dodo say na ebi o madwu ko omo committee suicide 1,005 nebia Ghana mental you for so the omo diaba bia diabetes nipa dodo say the level of diabetes I don't know the sad data na America for pen na health data na omo pen.
I think because me can report to the U.S. Department of State, and they said they are not obliged to make open or more terms of negotiation. No? And as to the exact terms, but sanka eba information I analyze, I produce, I be data. Yɛde ato abɔnten te sɛ deɛ yɛ report on I don't think sanka government will issue with it.
Okay.
But maybe point here where they will almost they will have access to the data with limited safeguards, which means that you better go to the basic enumeration unit of that data. And it means that individual data might be accessed. That is what I think. But me
Oh, okay.
In the M say a solo government then advisors will look at all the legal issues and whether that will be in the best interest of Ghana. And you know when so has national security implications. And I'm sure all those considerations will be made before they give access to
all
them.
Right. All right. Doc, you better ask pa. Dr. Richard Boateng, a senior lecturer, health administration, University of Education. So, $109 million in Ghana, you are rejected. Judging from your economy, we need more money to solve a lot of problems. So, on the line, I have Dr. Kwaku Boateng, is a former lecturer, economic department here at university. Say, thank you very much. Say, why joining here? So, Doc, this 109 million, say a kebetimia ye bibi di amayo, ye the moral aspect is here and pese ye di a data bet to Ganwa. Can this, I mean, ye di begu economy no more, can this ye enye bibi fama economy no? Hello, Doc. Oh, okay, I'm told that Dr. Kwaku Boateng is off. We are waiting, sir, Obesa Ababio in the shortest time. So that is that. Sorry, Ghana rejects U.S. health deal over data concerns. Eti say me no ka say aman be say miensa and are rejected. Zimbabwe for rejected and Zambia for so rejected. Say they wouldn't allow Americans to have Ghana data, have their data. Na menemo kasa isu uko Kenya, similar issue happen in Kenya. Ama a consumer protection group so the Akoko to say they wouldn't allow the government say or share data with Americans. So that is that. So how important this data issue is all about. I think that we need to stretch this. Going forward this week, we stay in this matter. We bring the security expert, and of course, the data expert, and of course, security expert, data expert, and no more keka ho betimi aye pa e dey am because if it's about health, our health data is all over. So what else again that o men yanke pa yentimi nya ya ye fa nkoji se sika no nanka ye ho entoye.